West Park was very excited to be asked by the Toronto Central LHIN to develop and implement a long-term ventilation strategy along with a number of health service providers across Toronto to help pull patients from the intensive care units and move them into more appropriate settings. This is achieved through three main programs: CAVC, Transitional Ventilatory Services, and Home Ventilation Training.
CAVC stands for the Chronic Assisted Ventilatory Care Unit. It's an inpatient, complex continuing care unit, and we have 30 beds. The eligibility criteria for this unit are ventilated either all or part of the day, and we have a range of patients anywhere from those who are unable to communicate and move on their own, up to those patients who are up in their chair and they're actually interacting and moving around the center during the day. This program offers a place for people to go where they don't need acute care services and an intensive care, but they have nowhere to go to be discharged safely or comfortably into the community. So it's an in-between place, and people do call it their home.
Well, I came to West Park for rehab after having pneumonia. I've been here nearly 15 years. West Park keeps me active, and I'm not bored.
So the goal of the patients on CVC, I think, is to stay as independent as possible for as long as possible and to get the care that they need to maintain that independence. And they really rely on the team members to really do their job to help them maintain that independence and that control.
The staff are very good. I think they're caring. You can direct your own care.
Transitional program is a program that helps patients who are chronically ventilated in an ICU to help them transition to the home or the community. So this program offers the ability for these patients who are chronically ventilated in the intensive care unit the ability to move home or into the community.
I'm a quadriplegic, need 24-hour ventilation. I'm in the transition program so I can adjust to a simpler vent that'll be able to use in the community. What's unique about the transition program here is they have 24-hour monitoring, which wasn't available. They've taken my opinion into account whenever they're making adjustments to the equipment for me too, which is unusual.
There's many goals of the transition program from an organization perspective as well as staff perspective. One, these patients are medically stable. They don't necessarily need all the services of the intensive care unit, and they're in the ICU because they're ventilated. Second goal is that we would like these patients to be at home. We know that the ICU is not the best place for them, and integration back in the community is what's probably best for the patient.
After I finish the transition program, I'll be using a new ventilator, and then I'll be going back to Toronto East General Hospital temporarily, and then transitioning to Tobias House in the community.
Home Ventilation Training Program is an inpatient program on a respiratory rehab floor, and it's a length of stay of up to 6 weeks for people who need invasive or non-invasive ventilation. The program offers education and training for the patient, family, and any caregivers to ensure that the person can move back home to the community or wherever the discharge destination is, that they have the appropriate education, training, skills, and equipment.
Back in about the early 90s, I would say, I was having difficulty when I was sleeping. I wasn't breathing properly. I was getting headaches in the morning. I was tired all the time. And my local doctor in Windsor, it was beyond sort of his area of specialty to know how to treat that condition. I came up to West Park for a sleep study, and I was here for about a 9-week period to find the best way to treat my condition. The reason I came to West Park on this visit is a follow-up. I try to come every year to make sure that I'm still on track with all the treatments that are prescribed for my situation. I came to West Park because it continues to be, in my opinion, the center of excellence for treating the condition that I have. The home vent program is the best way I find for me to make sure that I'm getting not only treatment for your condition, but an education on your condition. They teach you everything about what you have so that you're not only armed with the best treatment, but the knowledge that you need so that if something does happen, you know what's going on.
At West Park, we're very fortunate to have skills and expertise in the area of long-term ventilation. We've had a number of very successful opportunities to move patients to more appropriate settings. And we've been able to successfully sustain well over 300 individuals across Ontario, and we're leveraging those skills and expertise to implement this strategy.